Great. Okay. So I'm just going to talk about atrial fibrillation. What is AFib? Atrial fibrillation is an abnormal rhythm. It's an arrhythmia. When people go to AFib, they go to irregular rhythm, which is coming from top chamber of the heart. Normally in a heart, which you see on the left, our heart rate and rhythm is regular. During exercise, your heart rate goes up. During resting, goes down. But when you're in atrial fibrillation, and the one on the right side, the heart rhythm becomes irregular. So here you see these spikes from the heart rhythm is completely irregular. So the right one is AFib, the left one is normal. In atrial fibrillation, in a normal heart, usually the signals are regular. The top chamber squeezes, send the blood to the bottom chamber. The bottom chamber squeezes, and the blood to the body. But when you go to atrial fibrillation, the top chamber of the heart goes to chaotic fast rhythm. So as you see here in this picture, and there's no good coordination between top and bottom chamber of the heart. So the right one is atrial fibrillation. So what is the epidemiology of AFib? It's the most common arrhythmia in adults. It's estimated about 1 in 5 people above the age of 80 would have some degrees of atrial fibrillation. And number of patients with AFib in the US is estimated to be 2.5 to 6 million people. And AFib is responsible for 500,000 hospitalizations per year in the US and 150,000 deaths annually. What causes atrial fibrillation? Why some people have AFib and some patients do not have atrial fibrillation? There are several risk factors for AFib. The most common one is obesity, smoking, excessive alcohol consumption, having hypertension or high blood pressure, diabetes, high cholesterol, coronary artery disease or blockages in the arteries of the heart, having heart failure, sleep apnea, kidney disease, thyroid disease, inflammation of the heart, and in some patients maybe genetic, especially those who are at much younger age. And in some patients, it's unknown, so we don't know why they have atrial fibrillation. Atrial fibrillation in Black individuals, Black individuals have higher, more risk factors, or AFib risk factors are more frequent in those individuals than other ethnicities. But interestingly, the prevalence of AFib is less in African Americans compared to whites or other ethnicities. But they looked at that to figure out why is that, and they found that the reason is Blacks, they get tested for AFib less compared to others. So that's why the official diagnosis of AFib is less, but it doesn't mean that it is less prevalent. If you check everyone, if you check all ethnicities, you put monitors and check them for AFib, then prevalence of AFib is about the same in most ethnicities. So the reason in Black individuals it is less reported is because we are testing them less. We're checking them for AFib less compared to the others. So what are the signs and symptoms of atrial fibrillation? It can cause irregular heartbeats. Some patients may complain of irregular rhythm of the heart. Some patients complain of skip heartbeats, heart racing, palpitations. Some people may say I have lightheadedness, dizziness, might have tightness in the chest, shortness of breath, I have fatigue, don't have energy, and some minority of patients are completely asymptomatic, so they may not have any symptoms when they are in atrial fibrillation. Atrial fibrillation is a progressive disease. I drew these lines when I was presenting, when I thought I have an audience, but I didn't. So these red lines are episodes of atrial fibrillation, and these blue ones are normal rhythm. Sinus rhythm means normal rhythm. So usually it's a progressive disease. It starts with brief episodes of atrial fibrillation. They become more frequent with longer duration. And then over time, it becomes persistent. They last for days. And then if you don't treat it, it may become permanent. At some point, patients may stay in AFib and they may not come out of it. And even if you want to fix the AFib, you cannot. So at that point, it's called permanent atrial fibrillation. What are the consequences of atrial fibrillation? The most common consequence is a stroke. Because the top chamber of the heart does not squeeze, so blood can stay there, can create blood clot. Blood clot can go to the brain, can cause a stroke. That's the most serious consequence of atrial fibrillation. Atrial fibrillation can cause congestive heart failure. It can cause worsening of quality of life. If you have symptoms, of course, you're going to have worsening quality of life. It can cause dementia. People with persistent atrial fibrillation are at higher risk of having earlier dementia compared to the others. It can cause hospitalization, as I mentioned to you in my second slide. About 150,000 of hospitalization in the US is caused by atrial fibrillation. How do we diagnose AFib? So, have some sort of monitoring of the heart. The most common one is EKG or ECG. If you go to doctor, I'm sure most of you have had this. It tells you if you are in AFib at that time that when they get the EKG. So if you're in AFib at that specific time that they put the pads or patches on your chest and then get the EKG, then you have a diagnosis of AFib. But AFib comes and goes. People might be in AFib for 2 hours now and may not be in AFib for the rest of the day. So then you can do a Holter monitor. So basically you put these patches on the chest. You can monitor the heart for longer duration. This often lasts you can do that for 24 hours, 48 hours. There are newer devices that the battery can last longer. There are patches you can put on the chest. You can monitor the rhythm for 24 hours or 2 weeks or up to 4 weeks sometimes. There are smartphones that you can get EKG on, and they're quite good in detection of atrial fibrillation. There are mobile electrodes that you can purchase. They're cheap. You can connect to your smartphone and you can get EKG for 30 seconds and it tells you if you have AFib or not. And lastly, there are small chips called implantable loop recorder. You can put it under the skin and the battery lasts for 3.5 years or 4 years. And it monitors your rhythm continuously, connects to your cell phone, sends everything remotely and tells us if we have atrial fibrillation. How do we manage AFib? It has 3 arms: lifestyle modifications, stroke prevention, and heart rate control or rhythm control of atrial fibrillation. If you have those risk factors, for example, if you have obesity, it is important to lose weight. This is a study showed that if you lose 10% of your weight, if you have obesity, the risk of atrial fibrillation recurrence goes down by 30%. That's just by losing weight. If you're heavy alcohol consumption, if you're a user, cutting back on alcohol helps a lot. This is a study published in New England Journal of Medicine, showing that patients who had abstinence of alcohol had 30% less risk of developing or having recurrence of atrial fibrillation compared to those who continued drinking. Other risk factors that it's important to work on are if you have high blood pressure, to make sure your hypertension is controlled. If you have sleep apnea, make sure to be tested for it. Make sure you treat sleep apnea with CPAP. Those are other factors that help to decrease the chances for recurrence of atrial fibrillation. For stroke prevention, most patients need to be on blood thinners or called anticoagulation. It's important to know that aspirin is not as effective in prevention of a stroke in patients with AFib. The blood thinners are warfarin, which is an old blood thinner, has been around for several years. Eliquis is another one. Xarelto, Pradaxa, these 3 are the most recent ones. And the benefit of the newer ones is you don't need to do any blood work, and they have less interactions with other foods and with other drugs. You may have heard about Watchman or amulets. There are small devices that you can put inside the heart. Everyone's heart has a small pouch here, and blood clot forms there in patients who have AFib. When you go put that plug in the pouch, the plug called Watchman or amulet, it can prevent clot formation and you can stop taking blood thinner. The good thing about it is you don't have the risk of a stroke goes down while you don't have to be on blood thinner, and you just take baby aspirin once you have that implanted in your body. It's usually recommended for patients who are not good candidates for blood thinner, such as if they have bleeding and they want to do something else, so that replaces the blood thinner. How do we control the heart rate or heart rhythm? Medications are one option. They are not 100% effective. They work about 40-50% of the time. They work as long as you take them. They may have side effects. Some patients do not have side effects and tolerate it well. Some patients may develop side effects. What is cardioversion? Cardioversion is electrically resetting the heart using electricity. It's done by putting these pads on your chest, and then once the patient is fully sedated and with electricity, you reset the heart. It doesn't fix AFib, but it just resets the heart, so you go back to normal rhythm, and it's just something temporary, basically. The most effective way today to fix atrial fibrillation is catheter ablation. So you go into the heart, you find the area that atrial fibrillation is coming from, and then you ablate around that area, and that can fix atrial fibrillation in about 70% of patients effectively. In some patients, last option could be putting a pacemaker in patients who these options were not effective, or they not a good candidate for ablation or not good candidate for medications. Putting a pacemaker can sometimes also help to fix atrial fibrillation. A Black patient with AFib has less chances for to be diagnosed with atrial fibrillation. They have. You hear me?
Yes.
Yeah, okay, perfect. I just was checking, make sure I'm not go to the last slide. Okay, all right, very good. So a Black patient with AFib is less likely to be diagnosed with atrial fibrillation, and also has less chances to be on blood thinner for stroke prevention. A Black patient with atrial fibrillation is less likely to be on medications to fix AFib or treat AFib, and also less likely to undergo catheter ablation to treat atrial fibrillation compared to other ethnicities. Unfortunately, a Black patient with AFib is more likely to have a stroke from atrial fibrillation because they're not on blood thinners. And again, unfortunately, is more likely to develop heart failure because of atrial fibrillation, because they're not getting treatment for atrial fibrillation. So it is important to pay attention to the symptoms, and it is important to be screened for AFib. It is important to treat AFib if you have AFib, and it is important to take blood thinners to prevent a stroke if you have atrial fibrillation. So I'm just going to summarize what I just said for in previous slides. Atrial fibrillation is the most common arrhythmia in adults, and it said arrhythmia means irregular rhythm of the heart. AFib can cause a stroke, can cause heart failure, can cause hospitalization, can increase the chances for dementia. It can affect quality of life. Atrial fibrillation, most patients have symptoms, and symptoms often could be heart racing, palpitations, fatigue, chest tightness, shortness of breath. Some patients might be asymptomatic, although that is rare. Most patients have at least some symptoms. Even if they think asymptomatic, when you fix AFib, they may say, "Oh, I thought my symptoms are from getting old, but now I know that it was from AFib." So that's I hear that very common in patients with patients who have AFib. We diagnose AFib by getting an EKG or do some sort of rhythm monitoring. We talked about Holter monitor. We talked about patches. We talked about loop recorders. Treatment includes blood thinners or anticoagulation. If you have obese, weight loss helps a lot. If you have sleep apnea, make sure you get tested for sleep, do a sleep study, and then fix it, get treatment for sleep apnea. If you have high blood pressure or hypertension, it is important to make sure it is controlled. Alcohol drinking, make sure to cut back on alcohol. These are all helpful steps that you can do to prevent progression of atrial fibrillation or recurrence of AFib. Patients often require medications to control their AFib. They may require catheter ablation, which is an outpatient procedure to keep them in normal rhythm and to prevent progression of their disease. Again, we discussed that unfortunately atrial fibrillation is underdiagnosed in Black communities, and therefore it is undertreated, and that the Black communities have higher risk for having stroke and higher risk for having hospitalization and higher risk for developing congestive heart failure because of atrial fibrillation. With that, I would like to stop and I'll go over your questions. I apologize for the technical difficulties, but I hope that this time you could see the slides and you can hear me.
Thank you so much, Dr. Habibi. So we do have a question, and And it says, so basically the reason why African Americans have more issues are related to social determinants of health and equity issues.
Most likely, yes. It's not because, as I discussed, the risk factors for AFib are higher, but the AFib diagnosis is lower. So it is the underdiagnosis is most likely because of that what you just mentioned. So we test them less. They may have less access to healthcare, so they may have less because of that, because of the inequity, so they may have been tested less. So that's why we underdiagnose them and they have less access to treatment.
And can AFib be caused by anxiety?
AFib does not caused by anxiety, but of course, it can trigger it. So if you have anxiety, you may have higher level of adrenaline in your circulation, and high levels of adrenaline can trigger AFib. Anything stressful in life can trigger AFib. For example, you may have a car accident, you may go to AFib. You may have a pneumonia, you may go to AFib. You may have GI upset, you may go to AFib, and you may have a stressful event in your life, you may go to AFib. None of these causes AFib. So you may have some substrate in your heart that is active, is not normal, but whenever these stressful events happen, can trigger it and may go to AFib.
Okay. And can AFib go away on its own?
It's not common, but rarely if there's a specific risk factor. For example, if someone has obesity and go in and out of AFib, and then they work on their obesity and they lose weight. I have rarely seen some patients who, after they had drastic weight loss, and if they, for example, if you're alcohol drinker, if you cut back on drinking, that you may not have recurrence of atrial fibrillation. Most patients may still have recurrent episodes, will happen at much less frequency, but sometimes you may see someone who they work drastically on controlling those risk factors. They may have very limited episodes of atrial fibrillation with much, for example, may have one every couple of years instead of having one every few months.